Hello, everyone, and welcome. Today, we're going to talk about something that matters deeply: the treatment of colorectal cancer. Colorectal cancer is the third most common cancer in the United States, and sadly, it is still one of the leading causes of cancer related deaths. But here's the encouraging truth: medicine has come a long way. Today, we have more effective treatments than ever before, and for many people, these treatments save lives. In this video, I want to walk you through the three main treatment options we use: surgery, chemotherapy, and radiation therapy. We'll look at what each treatment involves, when it's used, and what patients can expect during the process. So, take a deep breath. Let's begin this important conversation together. The treatment approach. Before we dive into the details of each treatment, let's step back for a moment. When we treat colorectal cancer, there is no single one-size-fits-all approach. The treatment plan depends on several key factors. First, the stage of the cancer. Is it early, locally advanced, or has it spread to other organs? Second, the location of the tumor. Is it in the colon or in the rectum? This makes a big difference in how we choose treatments. And third, the overall health of the patient, including age, existing medical conditions, and how well their body can tolerate certain therapies. It's also important to understand colorectal cancer care is a team effort. Surgeons, medical oncologists, radiation oncologists, pathologists, radiologists, and specialized nurses, they all come together to design the best plan for each patient. This collaboration ensures that every decision is carefully tailored to the individual. And with that foundation in mind, let's start with the first and often most critical treatment: surgery. Surgery. For many patients, surgery is the cornerstone of treatment. If colorectal cancer is detected early, surgery can often remove the tumor completely, and in some cases, that means a cure. Now, the type of surgery depends on how advanced the cancer is. For very small early cancers, sometimes we can remove the growth during a colonoscopy. This is called a polypectomy or a local excision. For larger cancers, we may need to perform a colectomy. That means removing part of the colon that contains the tumor, along with the nearby lymph nodes. In rectal cancer, the surgeries are a bit different. Procedures like a low anterior resection or an abdominoperineal resection are commonly used depending on the tumor's exact location. Today, many of these operations can be done using minimally invasive techniques, such as laparoscopy or robotic surgery. This means smaller incisions, less pain, and quicker recovery. In some cases, a patient may need a stoma. That's an opening on the abdomen where stool exits into a bag. Sometimes it's temporary, just while the body heals. In other situations, it may be permanent. Of course, like any operation, surgery carries risks: bleeding, infection, or changes in bowel habits. But overall, surgery remains our strongest weapon when the cancer is still localized. Yet, even after the tumor is removed, there's always a chance that microscopic cancer cells remain. And that's why we often turn to the next treatment: chemotherapy. Chemotherapy. Chemotherapy is another key tool in the fight against colorectal cancer. It uses powerful drugs to kill cancer cells, not just in the colon or rectum, but throughout the entire body. When do we use it? There are three main situations. After surgery, this is called adjuvant chemotherapy. The goal is to kill any cancer cells that may have been left behind and to lower the risk of the cancer coming back. Before surgery, known as neoadjuvant therapy. This is especially common in rectal cancer. It can shrink the tumor, making it easier and safer to remove. And in advanced stages, chemotherapy can slow the disease, shrink tumors, and help relieve symptoms. The most common drugs we use include 5-fluorouracil, capecitabine, oxaliplatin, and irinotecan. They may be given as pills or through an intravenous infusion, often in cycles that repeat every few weeks. Now, chemotherapy is powerful, but it does come with side effects. Patients may feel fatigued, they may experience nausea, diarrhea, hair loss, or numbness in their hands and feet. But here's the good news. With modern supportive medications, many of these side effects can be managed or reduced, and research is moving forward quickly. Today, we also have targeted therapies, drugs that attack specific molecules in cancer cells, and in certain patients, immunotherapy, treatments that help the body's own immune system recognize and fight the cancer. Chemotherapy has extended survival for countless patients, and in combination with surgery, it can be life-saving. But there's another treatment, especially important in rectal cancer, that works hand in hand with chemotherapy, and that is radiation therapy. Putting it all together. So, how do these treatments work together? The answer is through a multimodal approach. For many patients, it's not just one treatment, it's a sequence carefully designed to maximize success. For example, a patient with rectal cancer might first receive chemotherapy and radiation to shrink the tumor, then surgery to remove what remains, and afterward, additional chemotherapy to lower the risk of recurrence. On the other hand, a patient with colon cancer may go straight to surgery, followed by chemotherapy, especially if the cancer has spread to the lymph nodes. Every plan is unique. It depends on the stage of the disease, the genetic profile of the tumor, and the overall health of the patient. That's why personalized medicine is at the heart of cancer care today. But we must also remember something else. Treatment is not only about removing cancer, it's about supporting the whole person. Nutrition, physical activity, managing side effects, and emotional support all play a vital role in recovery. The good news is that survival rates for colorectal cancer have improved significantly over the last few decades. Thanks to earlier detection, better surgery, and more effective therapies, patients today are living longer, healthier lives. And that brings us to the final part of our journey, a clear summary and the message I want to leave you with. Conclusion and call to action. Let's take a moment to recap. Surgery is often the first and strongest step, removing the tumor directly. Chemotherapy goes further, targeting cancer cells that may have traveled beyond the original site, and radiation therapy helps shrink or control tumors, especially in rectal cancer, making other treatments more effective. Together, these three treatments form a powerful defense, and when combined with supportive care, they give patients real hope for recovery. But here's the most important message. Early detection saves lives. A routine colonoscopy can catch colorectal cancer before symptoms even appear. And when found early, treatment is not only easier, it is often curative. So if you are over 45 or if you have a family history of colorectal cancer, please talk to your doctor about screening. If you or someone you love is facing this disease, remember, you are not alone, and modern medicine has strong, proven tools to fight it. Thank you for joining me today. If you found this video helpful, please like, subscribe, and share it with others. It could make a difference in someone's life. And as always, for personal medical advice, please consult directly with your healthcare provider. Take care, and I'll see you in the next video. Conclusion.